Hello and welcome to my channel, Lifestyle and Fashion Tea. And on this channel, we talk about everything from fashion to reaction. Well, as you can see here, RFK Jr. says MMR vaccine is the most effective way to prevent the spread of measles. Well, let's get into why he now is saying this. Ladies and gentlemen, this is my third video on the measles outbreak. Please be sure to get your children and yourself vaccinated. Please be sure to get yourselves vaccinated because this is growing into a severe problem. A severe problem. As of Friday, Texas has reported 481 outbreak associated cases, according to the Texas Department of Health. A funeral for the latest victim was scheduled for Sunday afternoon, according to an obituary. HHS is partnering with Texas health officials to better combat the measles outbreak in the state and has deployed teams from the U.S. Centers for Disease Control and Prevention to the area. This child, let me also say, was not vaccinated for against the measles and had no underlying health conditions. This problem is not going to end by not getting your children vaccinated. It's only going to get worse. The measles, mumps, and the rubella, which is the MMR vaccine, is the most effective way to prevent the spread of measles. Now Kennedy says this. Now he says this because an 8-year-old in Texas just
First
passed
day at the Food and Drug
again.
Administration, Dr.
Let's
Peter
get into
Marks
this.
evaluated and researched vaccinations, saving countless of lives. He played a key role in Operation Warp Speed to bring Americans COVID vaccines and treatments. Now he's gone, a departure that
just like everything else is leaving or gone, we know why he's gone, and he will tell you.
Shockwaves through the medical community. He says HHS Secretary Robert F. Kennedy Jr. didn't require truth and transparency, but instead wanted confirmation of his longstanding skepticism of vaccines. That is, until yesterday. In his strongest endorsement yet, RFK Jr. says that the MMR vaccine, which helps protect against measles, mumps, and rubella, is the most effective way to prevent the spread of measles. The secretary said this actually while visiting 2 families in Texas whose children have died from the virus. Those deaths, part of a massive outbreak in West Texas, which has seen nearly 500 cases now. The CDC is deploying a second response team to the area. Oncologist, hematologist, and former director of the Center for Biologics Evaluation and Research at the FDA, Dr. Peter Marks, joining me now. Doctor, as you cited in your op-ed, Kennedy's misinformation on vaccines was the reason that you left. So why do you think he's encouraging the use of the vaccine now?
Thanks so much for having me today. So I think he's doing this. I'm not going to really speak to a lot to Mr. Kennedy because I'm more interested in getting children protected against measles. But I would urge people to look at his statements, which seem to be on both sides of the coin. He did not have a full-throated endorsement. You should get your child vaccinated. We need vaccination now in communities. And I think I'd love to see that the CDC goes out there and touts vaccination as that is the way you prevent measles. That's the way you prevent children from dying from measles. Vaccination is how we will get this under control. Vaccination is how we could have protected our children so that we would not have had the first 2 childhood deaths of measles in the United States in the 21st century. That's right. These two deaths are the first two children to die of measles in 2025. And that says something very significant. So we need to have a full out, full bore campaign about trying to get measles under control here. Because if we don't get measles under control, and the state of Texas is concerned about this, their state health department has noticed this. If we don't get this under control by the end of this year, we will lose measles elimination status, and that will be very significant. But what's much worse, because measles reproducibly kills about 1 in 1,000 children who it affects, we will lose more child's lives.
And, you've just pointed out what makes measles so dangerous, but I think we should also point out why vaccines are so effective.
Yeah, so I really appreciate that question. So let's just remember that the measles vaccine is one of the vaccines that has one of the most favorable benefit risk profiles. We can sit here and argue about flu vaccines, COVID vaccines, other vaccines, but the childhood vaccines have been incredibly well studied. And the measles vaccine, which is credited with saving 50 million lives over 50 years, is remarkably safe and remarkably effective. In terms of safety, it's true that in about 100,000 children vaccinated, about 15 to 20 will have a medically attended event. Those are all transient events. Many of them are actually preventable by monitoring your child's temperature and keeping it from getting above 101 degrees after they get the vaccine, because about a week after, many kids get fevers. But measles vaccine does not cause death. It does not cause encephalitis, a swelling of an infection of the brain, and it does not cause autism. On the other hand, measles kills per 100,000, 100 to 120 children. And that's simply just a very simple calculus. Either you have a vaccine that can save the lives of 100 to 120 children, or not vaccinate your child and lose our children and lose that opportunity. So it's a very simple calculus to me. We need to get over this issue of having needless deaths, senseless deaths, by encouraging parents to get their children vaccinated. And I would just ask parents, I know we want to do the best by our children. If you have concerns, you ask your doctor. If you have concerns about your religious beliefs and vaccination, ask your clergy member. But we need to have these concerns answered, because we must get measles vaccination rates up so that we protect those who we love, our children.
I have to, as I'm listening to you, and I understand you were feeling pressure and you didn't believe in the misinformation that was being put out there, and you definitely were not agreeing with how the HHS secretary was dealing with things. But as we talk about the CDC dealing with this outbreak, as the department just lost 1/5 of its workforce, the agency is it going to be prepared for future outbreaks? And then a voice like yours that was so important to be in the mix, why resign? And are you concerned about the future of the agency now?
Let me make no mistake about it. I did not leave on my own terms, okay? So you can take that and interpret it as you like.
Didn't resign.
Worry. I resigned. I said
okay.
I didn't resign on my own terms, okay?
Okay, I gotcha.
Sometimes, I think there's already been reported in the press that I was given an alternative. But let's leave that, because what's so important here is that we as a country, I don't care about me. I'm going to land. I'll be okay. Okay. I'm going to be okay. But I'm not sure that our children of this country are going to be okay. Because just as sure as this thing continues to spread,
happened next.
The number of cases that have been reported to date, about a little over 600, probably only represent about 1/5 of the actual number of children infected.
The measles outbreak in Texas growing more deadly. Health officials confirming an unvaccinated school-aged child in Lubbock with no reported underlying conditions is now the second to die from the highly contagious virus.
We have lost a bit of our future, which could have been prevented with a vaccine that is 97% effective.
The victim, an 8-year-old girl named Daisy, according to Health and Human Services Secretary Robert F. Kennedy Jr., who traveled to Texas Sunday to attend the girl's funeral. Afterward, Kennedy, a vaccine skeptic who has spread misinformation in the past and downplayed measles risk, writing on social media, the most effective way to prevent the spread of measles is the MMR vaccine. His most direct statement yet. More than 600 cases have been reported nationwide this year, more than 480 of them in Texas alone, including a 14% spike in just the last week.
We just don't know how bad it's going to get.
Megan Messick owns this daycare where the rapidly spreading virus has infected 6 kids and says she's frustrated with the federal government's response.
Our city needs more. We need more federal help. Our testing is behind. I mean, kids getting tested on a Friday and we're not getting the results till Monday, sometimes Tuesday. That's a huge problem.
The question on so many minds this morning, when will it end? Pediatrician Ana Montanez is on the front lines in Lubbock.
I don't see a quick end to it. There is a very real possibility that we may be dealing with this for an entire year, if not more.
Please get the vaccine. This is something that can totally be controlled. Totally be controlled. Now, last time we let Trump in, we had COVID and it got all out of order. Don't let the measles or any other sickness or disease or anything else, don't let Trump ruin this again. Please. Get the shot. If you don't want to get it, please get it for your children. I run a daycare and I don't want to get sick. I am just getting over a cold now, and I have been battling this cold for a week. Trump is not going to think about us. He does not care about us. So we have to care about ourselves. Thank you.